Studies are mixed on whether or not there is a July effect on care in hospitals when the new residents arrive, but research has shown communication breakdowns between residents and the attending physicians who supervise them are common. Joining us to discuss is WSJ Assistant Managing Editor Laura Landro and Head of the Surgical Residency Program at Brigham and Women's Hospital, Dr. Douglas Smink. Welcome to both of you. Laura, I'm going to start with you. So that old accepted wisdom that you should avoid the emergency room on weekends in July isn't necessarily true?
Well, it's not true. I mean, there's some issues also with everybody's on vacation. The new residents are starting. There's some studies that show there is a risk that's higher. Others debunk that idea.
So, Dr. Smink, evidence from studies collected at your and other hospitals shows that as many as a third of critical events were not communicated by residents to attendings. So what are some of the ways you have empowered your own residents to alert senior doctors when needed?
So we've created escalation of care cards in our residency program, which have now been adopted around our institution and actually beyond in multiple institutions around the country, where we try to specifically define which episodes within a patient's care should be escalated to the attending physician on the team.
And Dr. Smink, it's my understanding that the laminated cards are quite specific. Is that right?
They are. They're quite specific. They go as far as transfer to an ICU all the way down to transfusion of blood, for instance, and everything in between.
Okay, now, Laura, in the past, has there been a stigma attached to residents who have to call on attending physicians, and does that perhaps encourage some from doing so?
Well, Dr. Smink himself wrote an editorial saying, you know, calling is not a sign of weakness, because there was an old surgeon's adage which said, you can call me, but I'll think of it as a sign of weakness.
Right.
So there is that kind of medical culture where you got to toughen these kids up and get them, you know, ready to practice independently.
Right. I guess that's part of the issue, right, Dr. Smink? There must be a balance that has to be struck between having residents learn to deal with situations on their own and to escalate when necessary, correct?
That's exactly true. Residency training in surgery is 5 years long, and over that period of time, the residents need to have increasing autonomy so that by the time they finish, they're ready to practice on their own. At the same time, the attending surgeon has responsibility for the patient, and it's a learning experience for the resident to share that information up the chain so that they can not only have the attending surgeon be aware, but have the attending surgeon educate them on how to take care of those situations.
So, Laura, it seems to me from reading your article and the residents you spoke to, it seems that the more specific the situations are where they know they should escalate,
right,
the more assured they are about it, correct?
Right, exactly. And Dr. Atul Gawande, who did a lot of this research, basically has said, you know, we're telling our chiefs of surgeons that you have to say to your attendings, this is what we told the residents they have to call you for.
Right.
And you have to be receptive when they call you.
Be prepared,
right,
because
exactly.
This is when they will call you. So, Doctor, have you seen better results since you have started this card lamination program?
Well, studies have shown that there is more frequent communication and that these episodes that the cards outline are more frequently conveyed up the chain to the attending surgeon. So yes, we're starting to see some important results. And
Laura, do patients have any agency here? I mean, in this equation, obviously, some of them are nervous going to the hospital,
sure,
hearing the stories that they hear about summer residents.
Right.
What should patients do?
Well, at any time, and I think they will tell you this at these hospitals, at any time, one of the other reasons you can, you know, escalate to an attending is if the patient or family asks for it. You say, I want a doctor to come, a doctor should come.
Right. Laura Landro and Dr. Douglas Smink, thank you so much for joining us today.